Well, as you know, we had a urgent situation last Friday following the death of a second employee. Since that time, the health department has conducted their preliminary epidemiological investigation. In addition to that, we had the entire building over the weekend was vacated, and we desanitized, we sanitized, disinfected, including fogging and wiping down every surface in every office, and completed that. And we reopened at 8 o'clock this morning. As of this morning, we have not had any additional cases reported in the IT department. We did learn over the weekend that the security department at the port had 3 cases during the same period, and all were not hospitalized, neither were they vaccinated. One of the employees is back at work today, healthy at the port, fortunately. And we should be getting the report from the health department, the preliminary sort of epi-stats on timeline of case 0 through the last known case, which was the individual that passed away last Thursday. All of the known cases were not vaccinated. In fact, we know one individual in the IT business services unit, a 23-year-old employee who is vaccinated, had contact with the coworkers and did not contract COVID. We know that there are 2 additional employees that were identified in the contact tracing that did get tested over the weekend, and those 2 employees did come back negative as well. Well, I think this particular outbreak demonstrates the effectiveness, I believe, with the vaccine. All of the cases were non-vaccinated; they were unvaccinated, and we know of individuals in these departments that were vaccinated, fully vaccinated, and they did not contract the infection from their coworkers. We want directors, when they become aware of employees that are out and have tested positive, to make sure that we have a central reporting location in human resources so that we can ensure that people are adequately notified. The case 0, which was the first known case in the department, apparently had symptoms the week of the 21st, around there, and was confirmed positive on the 29th. I think the 27th and 28th, the individual started feeling symptoms, stayed home, and then on the 29th was tested and found to be positive. That individual appears to be case 0. And on Friday, after following 2 deaths within a 4-day period in one department and 5 known cases, and not knowing the status of vaccination versus unvaccinated, the initial concern was that we could have a variant that was not susceptible to the vaccine. That's the reason for taking the position on Friday. Saturday morning, we became aware from the health department that we actually had vaccinated individuals that did not contract the virus. Therefore, the position on Saturday was a recommendation that if you were not vaccinated and you're a visitor or an employee coming into the building, that it's strongly recommended that you wear a mask, and not just any mask, that you wear an N95 or KN95 equivalent mask, which is the type of mask that protects the wearer from contracting the virus as well as from others should the wearer have the virus. Now, we don't know whether or not it was a variant. Even the Delta variant, which this appeared to behave like the Delta variant. We're waiting on confirmation of what variant we're dealing with. The vaccine appears to be effective for the Delta variant. Keep in mind, we had 5 cases within the IT department, and 2 of the 5 cases died within 2 weeks of contracting the virus. That's a 40% case fatality rate. That is a high fatality rate. And so that's the reason for taking very serious, precautions immediately to protect employees and visitors in the building. And so my suspicion as an epidemiologist is that we're dealing with a variant unlike what we had last year. Well, this event touches, gets really close to home for our employees. And I will tell you, a number of employees on Friday not only went and got tested, but they got vaccinated at the same time at the same location where they got tested. They were vaccinated. And as you know, we've released information that we'll hold another vaccine clinic here in this building for both employees and for families. No, I believe that we probably have a variant that is unlike the variants that we were experiencing a year ago. This seems to be a very contagious variant, and based on these 5 cases, in this situation, it was a 40% case fatality rate. That's very high. Well, I will tell you that when I transition through the building, I'm fully vaccinated. When I transition through the building, I'm wearing a KN95 mask or an N95 mask. It's the recommendations that I had put on the doors this morning, that if you are unvaccinated, it is recommended that you follow the COVID prevention guidelines, which includes an N95 or KN95 mask, social distancing, and sanitizing, washing your hands frequently. No, I have not heard. No, absolutely not. I have not heard from the governor on this issue.